First Talk. I'm Tamara Bull. We have a really important show for you today because we're going to be talking about your health and ways to improve your child's safety. You might remember Dr. Jay Wortman from his work on CBC's My Big Fat Diet. Dr. Wortman's prescription to combat diabetes is a low-carb diet. He's going to be making a delicious barbecue pork dinner. Also, Canada's ranking amongst the G20 is very low when it comes to childhood safety. Today, we're going to find ways to improve the safety of homes. But first, there will be an estimated 153,000 new cases of cancer in Canada this year. Dr. Lemmo is a forward-thinking doctor that combines tradition and alternative medicine to help people suffering from cancer. Well, it's a pleasure to introduce you here. I'm so glad you're on the show because this is an important issue for so many Canadians.
Thank you.
So tell us a little bit about some of the medicine that you work with when it comes to cancer patients.
Well, I'm in a field that I guess they're turning more and more called integrative cancer care, where they're putting together a whole series of tools. And some of these tools are some of the common sense tools where it's about sleeping right and eating right and improving the quality and that kind of framework of things. There's also, you can be incorporating some supplemental medicines that could be useful in cancer care. You're hearing a lot of research, say, on vitamin D in cancer for prevention.
Vitamin D in cancer?
Yeah.
Really?
Yeah. There's a great amount of data that's been published. We're showing that simply by taking vitamin D, it can really help to decrease your risk of like breast cancer and other types of cancers. But also, there's a group of data showing that with patients with higher level of D in their blood, they can actually minimize their cancer from coming back. That's been shown with breast cancer, for example. Colon cancer has been showing some data as well. So that's one part of the things that we try to do and talk about. And
so people should be taking vitamin D.
Well, for me,
in preventative measures. You take it, obviously, you must.
For me, it's a bit of a no-brainer because I'm in the field, I'm in the trenches. Like when this research came up, I was already testing for vitamin D 5 years ago, so I kind of knew there was a trend. So in my family, for example, they're taking it. My older sister, I check her levels out, and hers was low. She's on it now, and so.
Well, that's pretty good. They got a doctor in the family who's come to you, and they're like, oh, they must call you 24/7 now with all their complaints.
Well, you know, the key is that if you can prevent it, you're ahead of the game right there. And then, because when you're treating it, sometimes, depending on the type, it could be a bit more complicated. And so.
But there's a whole wave happening now. There's a lot of people sitting at home going, because this is a really important issue in Canada. What is it, 1 in every 2 or 3 people in Canada will get cancer?
Yeah, that's correct.
Yeah. So it's a huge issue. So people are sitting at home and they're saying, wow, these are huge statistics. So tell us what people can do to prevent getting cancer, aside from D.
Yeah, well, I think there's many roads to Oz, you know, and that's something that people
Many roads to Oz?
Many roads to Oz. You know,
that's
like the Wizard
really
of Oz,
great.
you know?
The Wizard of Oz, yeah.
You know, and
hey,
so
that's one of my favorite movies too.
and so you know, there's some general things that are classically talked about. So one thing is minimize cancer-causing things like cigarette smoke. You know, we know that can cause, you know, cancers, right?
Yeah.
But also we're seeing a lot of data showing that, you know, when people are getting more sedentary, they're not moving around as much, they can actually increase their risk of cancers.
Really?
Absolutely, yeah. We're also showing that when people have a bit more fat on their tummies, it can increase their risk of cancers. We're seeing that with breast cancer, for example. And that's why I say, just talking about breast cancer, especially with the postmenopausal women, if you actually tell them to lose some of the weight on their tummy, they can actually help them with their treatments and minimize recurrence as well.
See, that's really fascinating because when you're thinking about the importance of health, we're constantly emphasizing on the show, people at home and people in Canada need to lose weight, and that's such a great way to, I mean, it's serious. I mean, it's very serious complications.
It's very serious, and what we're seeing in essence is all these environmental and lifestyle factors really increasing people's risk of getting these types of diseases. And what's interesting, though, is that even with people having these diagnosed diseases, by incorporating these lifestyle things, you can really impact those as well so that people can actually do better. They can do better with their treatments. They can try to minimize from the diseases coming back as well. And so the data is really starting to grow and bloom in that direction. That's what's really, really exciting.
So when you're talking about people preventing cancer, how many times should people work out a week?
Well, here's the thing, is that a lot of people don't realize, well, what's the magic number of intensity, right?
Yeah.
And that's really the big confusion, and it doesn't take much.
It is very confusing. Like, I never know what is going on in there.
Well, here's the thing. You know, this is what made me fascinating, is that, say there's been some statistics showing that women diagnosed with breast cancer, those that move live longer. Okay, and sometimes dramatically longer, up to like 67% longer.
Really?
Which is
67% longer. That's huge.
Huge number, right? You know, I wish chemos and radiations were that strong, you know what I mean, in general. And so, and you know what, when you look at the stats, you know what it was? Them walking 3 hours a week, okay? So 3 hours of physical activity up to 5, okay? So that means walking every day for about half an hour could impact people's diseases. Walking an hour could be more, you know?
Yeah.
Obviously, if you have more to lose, you have to kind of adjust that more so from a prevention standpoint. But even when people with a diagnosis, that you can actually impact those types of disease just by simply walking.
Wow.
So that's the thing that I even learned, to be honest, in myself. I was going like, well, what's the magic?
Do you work out?
You know, like everyone else, right? Like, I'm honest, right? Like,
Yeah.
I'm the type of doctor who's like middle of the road kind of guy, you
Yeah.
know? And because I think there's more to it being. It's not just food, and environmental is also your soul too. You know, you
Yeah.
got to satisfy that part of your being. But you know something? I really try to move as best as I can. But when I have my off days, you know, like I don't feel like I don't want to go to the gym or I don't want to do this. But there's other days I'm going, you know, I really have to do this for myself and my well-being. And so now, like I've been working out more consistently the past 3 or 4 months. Before it was summertime, I was doing more other types of activity.
Summer's easy though,
Yeah.
because all you have to
Yeah.
do is wake up with a spring in your step and go outside, and you find yourself doing tons of stuff. I mean, it's so easy.
Yeah, absolutely. But the key is that it's not so much the term exercise is probably the wrong term, but it's really movement.
Movement,
It's really
yeah.
movement. So if there's, say, I have some patients, you know, they love gardening, you know, and so that's their thing. Now they're doing more internal stuff. Others are kind of always doing this mega housework around the house, and that's actually been shown in breast cancer statistics too. You know, women that do more housework can impact the disease too. Just to let you know, right? So
being a clean freak is good for some people.
That's right. I've had a funny clip when I put that on my board for some of my patients, and they're going, "Did you do this on purpose?" I go, "Hey, it was from the sun." But the key is really about movement,
Yeah.
you know, and it doesn't take much. And if you're just walking 30 minutes to an hour a day, fantastic. But the key is consistency. You got to keep doing it all the time. It's not so much for 2 weeks and stopping for a month. It's like something you can consistently do.
But isn't that all success is based on people being consistent? So if people consistently say, I'm going to do this, and they're consistently successful, I think a lot of people at home probably recognize that. I mean, it's just doing it all the time, which is not always easy, but important.
It's not easy, but I think what needs to happen, people need to be educated on how powerful these things really are, but also having a system that people, like when people are slacking off, you know, hey, give them a kick in the pants. I think that's what I'm doing a lot in my office. You know, people are
really?
oh yeah, people
they're
coming in my office and they're going, you know, and say, because mostly what I deal is cancer patients, and so these are
Right.
people who have been diagnosed already, and they're starting to slack like everyone else does, and they come in to see me. And I'm going, are you walking around? Oh, I'm a little tired. Or I go, you better do this, or I'm going to kick you in the pants. And the next time you come in, you know.
And they're afraid of you. They go and they're like white knuckling in the waiting room, going,
You know.
"Yeah, I got to get in there any second."
You know, and we just you have to make it fun, and got to be understanding too with these things. But yeah.
Different bedside manner. He white knuckles his patients. That's great. Thank you so much. Very important information. Coming up next, Dr. Jay Wortman is going to show us how to make a delicious low-carb pork chop.